Hi again. So the first section of the program is really the explanations and scenarios involving those explanations with regards to both schizophrenia and bipolar disorder. So we'll be taking the audience and care workers, I guess, through the narrative from the point of view of an expert and also a care worker. So the expert's voiceover will be used throughout this program as a narration, as a guide, as we carefully go through each disease and each step when it comes to signs and symptoms. And that'll also involve expert talking into the camera as well. So together with the expert talking to the camera, he's used the voiceover as narration. We'll also use white title cards, so it'll be white over black, which will give, I guess, key signposts throughout the program, which will help, I guess, the viewer distinguish between what disease and symptoms and keep it as simple and as clinical as possible. The whole idea, I guess, creatively when it comes to this project is we really want to not hyperbolize this sensitive and complex issue. We want to treat it as real as possible. So we want to actually incorporate real sufferers of the disease sharing their anecdotal stories, and also while their stories are being shared, we're also seeing some of those scenarios played out in reenactments. And then we also incorporate a care worker in real situations, following the guides and direction of the expert in pointing out the symptoms, as well as best practice, safe practices when dealing with an older person who suffers from such disease. So the first section will focus on schizophrenia, and then we will also focus on bipolar disorder. So we'll have a clinical distinction between the two, using different patients as both sufferers, but using the same care worker throughout both stories. So there'll be a combination of real people sharing their harrowing and you know, inspiring and real stories with everyday scenarios that care workers might encounter and the best practices that they should adopt in dealing with these situations. So it will be a lots of talking to the camera, on-set real world situations, as well as clinical. So it's important that we keep it real. As I said, not hyperbolize it or over stylize this subject matter, which is often, I guess, you could say abused, but often over-styled by filmmakers and with a somewhat macabre, I guess, tone about it. We want to keep this real and somewhat, you know, put a human face and take the mask off the stigma and taboos that often comes with mental illness.